I'd like to introduce our first physician. That's Dr. Ferhan Asghar. His areas of expertise is orthopedic care, spine disorder, spine surgery, and scoliosis.
Thank you very much, Tom. Again, Ferhan Asghar. I'm the Director of Spine Surgery within the Department of Orthopedics at UC. Your mother was right. It's all about posture. It really is. You got to keep your spine, keep your back straight, and that helps you avoid cumulative injuries over the course of your lifetime. So biomechanics of the spine, there are three general areas in the spine. We call it the neck, the cervical spine. The upper back is the thoracic, and then the lower back is the lumbar. Most disorders are in the neck or the low back, which is the cervical or the lumbar spine. When we look at someone from the side, they should have a reverse C-type curve over here in their upper neck, in their cervical spine, and also in their lower back, in their lumbar spine. The intervertebral disc is made up of several layers of tissue. The example I'll give patients very often is a jelly-filled donut. Take a bite out of this, you get some jelly that ruptures out, and then it goes and pinches a nerve back there. You should have a curvature to your low back, and that curve comes from those discs. As those discs are juicy and spongy, they have pushed your bones into a proper alignment. As you lose that disc, then you start developing a flat back, or people end up kind of straight like this. When you're lying flat is when your disc sees the least forces going through it. But when you're sitting, you're actually putting more forces and more load on your disc than when you're standing straight. The worst thing you can do is bend over and twist while you're in a seated position. That is the worst thing for your disc. What happens if you bend and twist? The disc over here is put in tension and it can rupture, and then that's where the jelly comes out of the donut and pinches the nerves. This is an anatomic specimen of a disc herniation. Here's bone, the disc in between ruptured, and this is where the jelly from the donut is sitting on the spinal cord and compressing that. Different parts of your spine are involved in different kinds of motion. Bottom line, your T-spine doesn't flex and the lumbar spine, the low back, doesn't rotate. How do you lift properly? Bending and curving your spine is wrong. People say, put your back into it. No! Don't put your back into it. Put your legs into it. So try to avoid holding something far away and try to avoid lifting large objects. It's just awkward, and that's the kind of stuff that's going to put you in trouble. When you've had enough, it's time to knock on the door and get better.